Hi everyone, let's continue with the next topic, that is terms related to the body movements in general anatomy introduction. So movements usually occur generally in synovial joint. Synovial joint is a classified joint which helps in feasible movements. Wide variety of movements are possible at a synovial joint. So these movements are broadly classified into 4 types in BD Chaurasya. They are gliding movement. So any gliding movement is something which is occurring over the flat surfaces like this. So this is one flat surface, this is one flat surface. So between the 2 flat surfaces usually the gliding movements occur like front and backward or side to sideward. These movements are called as gliding movements. So usually the angle between the 2 articulating surfaces do not change, and these are called as gliding movements. Okay. And the second one, this is about the gliding movements. The second one is angular movements. Angular movements is nothing but these are the movements in which the angle between the articulating surfaces, for example this is the articulating surface these 2 are the articulating surfaces of this joint. So angular movements are the movements in which this angle between the 2 articular surfaces will either increase or decrease. So any movement in which the articular surfaces angle or the angle between the 2 articular surfaces is decreasing, it is called as flexion. So this is called as flexion of elbow. This is called as flexion of flexion of wrist, because the angle between the articular surfaces of the wrist joint is decreased. So this angle is decreased. From here, this is a normal anatomical position. From the normal anatomical position, there is decrease in the angle of the articulating surfaces, angle between the articulating surfaces of the wrist. So this is called as flexion of wrist. Similarly, this is the flexion of elbow. Similarly, for knee joint also, if this is a knee joint, if this is the anterior surface of the knee joint, so when we bend our knees, this is called as flexion of knees. Similarly, we do also have lateral flexion, in which we decrease the angle of the hip sidewards. This is called as lateral flexion. This is the lateral flexion on the right side. This is the left lateral flexion. Yeah. So these all are called as angular movements. A contra movement to flexion is called as extension. Extension is the movement in which the angle between the articular surfaces increased. So this is the flexed elbow. From this flexed elbow, if we are doing a movement like this, here the angle between the 2 articular surfaces of the elbow joint is now increased. So this is called as extension. Similarly, in this position, now when I am trying to increase the angle between the articular surfaces of the wrist like this is called as extension of wrist. Similarly, this is the extension of elbow and this is the extension of wrist. Similarly, when we are standing straight from a flexed knee or a bent knee like this is called as extension of knee. Similarly, so these are the angular movements. 2 angular movements, flexion and extension. Another group of angular movements are called as abduction and adduction. So this abduction and adduction are related to medial plane. Abduction, B for Bahar. Abduction is movement of the bone away from the midline. So this is called as abduction of my shoulder. So movement of any bone away from the midline is called as abduction. बोन बाहर जाने का मूवमेंट जो है वो अबडक्शन होता है, और बोन अंदर आने का मूवमेंट जो भी होता है वो अडक्शन, अंदर ANDAR अंदर इज डी अडक्शन. सो अंदर आने का जो भी मूवमेंट होता है वो अडक्शन होता है. सो दिस इज बाहर जाने का, सो अबडक्शन ऑफ माई शोल्डर एंड दिस इज अडक्शन ऑफ माई शोल्डर. सो एनी मूवमेंट इन विच द बोन इज मूविंग away from my midline, this is called as abduction. So this is called as abduction, and any movement in which the bone is coming towards the midline like this is called as adduction. बाहर जाने का जो भी मूवमेंट है वो abduction होता है, अंदर आने का जो भी मूवमेंट होता है वो adduction होता है. So these are another 2 angular movements, very important. So abduction and adduction. So This abduction and adduction occurs at almost many important joints, like here in the shoulder. If this forearm is coming towards the midline, this is called of the forearm. If this forearm is going away from the midline, this is called as abduction, bahar jane ka, so abduction of the forearm. Similarly, wrist joint में भी abduction adduction होता है, और we can see this in lower limb too, abduction of lower limb, abduction of hip joint and adduction of hip joint. So जो भी hip joint, so movement of thigh away from the midline is called as abduction. Movement of thigh towards the midline is called as adduction of hip joint. It's the adduction at the level of hip joint. So these movements are the angular movements. 4 movements: flexion, extension, abduction and adduction. So remember, abduction, that is AB. So bahar जाने का movement जो भी होता है bahar. So any movement in which the bone goes bahar, outside, is abduction. Adduction is the movement in which the bone comes D, here B, here D, here B, here D, therefore under. Yeah, this is how you need to remember, and initially you will confuse, but slowly when you are memorizing frequently, you will remember usually. Yeah. The next group of movements is called as rotation. The another group of movements is called as rotation. So rotation is a movement in which the bone revolves around its own longitudinal axis. So if this is the bone, its own longitudinal axis is this one. This is its own longitudinal axis. If it is rotating along this axis, like this or like this, like this or like this, this is called as rotation. So there are 2 types of rotations. Number 1 is medial rotation, in which the anterior surface, here we define this rotation in terms of its anterior surface, or in terms of the anterior surface of the bone. So जो भी bone का anterior surface होता है, if it is coming towards the midline, it is called as medial rotation. This is called as medial rotation. So any rotation in which the anterior surface in an anatomical position, so anterior surface of that bone is going away from the midlines. That is, if it is normal like this, if this anterior surface is going away from the midline, this is a midline. So this is called as lateral rotation. So this is called medial rotation, and this is called lateral rotation. Yeah. So here what's happening? The anterior surface is coming towards my midline. This anterior surface is coming towards my midline in medial rotation, and this anterior surface of the bone is going away from the midline. So it is going away from the midline in lateral rotation. So these are 2 rotations, medial and lateral rotation, needed to be understood. Next, special movements. Special movements, 4 special movements at least minimum to be remembered, usually occur at special joints like supination pronation. So this is supination, that is the hand and forearm facing upwards. This is called a supination. So this is occurring at the level of this joint, called as at the level of a joint which is present between the 2 bones of my forearm, which is called as radio-ulnar joint. So radio-ulnar joint के बीच में we have special muscles called as supinator muscles and pronator muscles, which aids these movements. So this movement where my palm and the anterior surface of my forearm are facing upwards is called as supination. Okay, the action in which, or the moment in which I am making my palm and the anterior surface of the forearm facing downwards is called as pronation. So this is supination, this is pronation. So this is supination, this is pronation. These 2 movements are special movements occurring exclusively at radio-ulnar joint. So at this joint only we do have special muscles called as supinator muscles and pronator muscles, which aids these movements. Number 2, protraction and retraction. So protraction is forward movement of my jaw. Retraction is backward movement of my jaw. So this movement is occurring at the level of, so this movement called as protraction and retraction are occurring at the level of my temporomandibular joint. So between my temporal bone and the mandible bone, temporomandibular joint. These movements of jaw, which are called as protraction and retraction. Protraction and retraction occurring exclusively at the level of temporomandibular joint. Yeah. Now we will see in every region, special movements in every region. For example, in upper limb flexion. So upper limb flexion. As we already discussed, what is flexion? Flexion is nothing but it is the movement in which the angle between the two articular surfaces is decreasing. So for example, this is the flexion of my wrist. This is flexion of my elbow. And extension. So this is the extension is a movement in which the angle between the two articular surfaces, जो भी दो articular surface होता है इसका बीच में जो भी angle है वो increase होता है, extension होता है. So this is extension of my elbow joint and this is extension of my wrist joint. Similarly, for my knee joint too, if this is my knee, this bending is called as flexion, backward bending is called flexion, and standing still or standing straight is called as extension at the level of knee joint. Yeah. So this is about flexion and extension. Abduction and adduction, as we already discussed, this is called abduction at the level of my bahar jane ka at the level of my shoulder joint, adduction andar aane ka at the level of my shoulder joint. Yeah. Circumduction is something special movement which includes four things. It is a circular movement. Yeah, circumduction is something like this: flexion, extension, adduction, abduction. Flexion, abduction, extension and adduction. Yeah, a circular movement which includes circumduction. Circumduction is the combination of four movements like flexion, adduction, extension and abduction. All these together called as circumduction. It's a circular movement. Okay, so this is circumduction. Next, medial rotation. As we discussed, the anterior surface of the bone is coming towards the midline. This is called as medial rotation. If the anterior surface of the bone is going away from the midline, this is called as lateral rotation. So medial rotation, lateral rotation, medial rotation, lateral rotation. Next, supination, pronation, as we discussed, this is supination, this is pronation. This is supination, this is pronation. You can define it very easily. Next, abduction of digits or fingers. As we discussed in the, similarly as we discussed in this other parts of the upper limb, even the fingers, if the fingers are coming close together, अंदर आ रहे fingers सभी भी center points से the central axis को central axis के साथ अंदर आ रहे हैं. So this action is called as अंदर आने का adduction of fingers. This action जो भी the central axis of the fingers से the other fingers are coming outwards, बाहर जा रहे हैं. So this is abduction of fingers. So this is adduction of fingers अंदर आने का, और this is abduction of fingers और बाहर जाने का of the fingers. Yeah. Next, apposition of the thumb. Apposition is nothing but this is called as thumb apposition. The ability of the thumb to touch all other fingers is called as thumb apposition. That is, this thumb is able to oppose all other fingers like this. Yeah, so this special movement of thumb is called as apposition. Apposition movement is specifically shown by thumb. 1, 2, 3, 4. Any other finger, unlike thumb, any other finger is not able to touch all other fingers. You can try. You can't. Like that. This one can touch this one, but not the little. Yeah, so this movement is called as apposition. So apposition is a special movement of the thumb in which the thumb can touch all other fingers. This is called as apposition of thumb. Next, circumduction of thumb, same. The flexion, adduction, extension, abduction. All four movements together occurring in thumb is called as circumduction of thumb. Done. Lower limb movements, same. Yeah, you can you can define flexion of thigh. That is, flexion of thigh is the angle between the articular surface angle, the angle between the articular surfaces of hip is decreasing now. That is, this one is flexion. Sorry. Yeah. So this one is flexion. This one is flexion. So flexion of thigh. This is the flexion of thigh. So the angle between the articular surface of the hip joint is decreasing in flexion of thigh. So this is the flexion of thigh. Extension of the thigh, from flexion to you need to decrease the angle, that is standing still. That is extension of thigh. Similarly, abduction of the thigh, that is moving my thigh. Abduction, bahar jane ka, moving my thigh outside away from the medial line, away from the medial plane. this is called as abduction of my thigh. This is not adduction, this is adduction, ADU. Okay, this adduction is andaranaka. That is movement of my thigh towards the midline. It is adduction of thigh. Next, lateral rotation of thigh. My anterior surface of the thigh, this one. My anterior surface of thigh is moving like this. That is moving towards the midline. This is called as medial rotation. Sorry. And if this anterior surface of my thigh is going outwards, it is called as lateral rotation. This is about the thigh. Regarding the knee, flexion of the knee. If this is my knee, anterior surface, this is called as, that is sitting on squatting position. What's happening? Your knee is flexing. Your knee is flexing, so that is called as flexion. Standing still again is extension at the level of knee joint. Next, dorsiflexion and plantar flexion of the foot. So remember, the anterior part of the front part of the foot, which you see in the anatomical position, is called as dorsum of the foot. Okay, as we call this area palmar region, this thick skin area of the foot is called as plantar region. What is it called? Plantar region. Okay, this is the dorsum of the foot, this is the plantar region of the foot, or ventrum of the foot, you can say. This is the dorsum of the foot, this is the plantar region of the foot. Like this is the dorsum of my hand, this is the palmar region of my hand. So, but in an anatomical position, the dorsum of the foot is anterior. That's the difference between hand and leg. So, here, what is plantar flexion and dorsiflexion? So, at the level of foot joint, we don't call flexion extension. We call both flexion only. That is, if that is angle should be decreased. That is angle between the articular surfaces, that is dorsum of the foot and the anterior surface of the leg. If this angle is decreasing, that is this movement is called as, that is bringing your foot towards your anterior surface of your leg. This movement is called as dorsiflexion. That is, you are decreasing the angle between the articular surfaces, that is which surfaces? Your dorsum of the foot and your anterior surface of your this angle. Yeah, this is called dorsiflexion. Similarly, if the angle between these two surfaces, the plantar surface of your foot and the posterior surface of your leg, yeah, this angle is decreasing, that is moving my foot like this, that is standing on your toes. This movement is called as plantar flexion. This movement is called as plantar flexion. So these two movements are also important. Next, inversion and eversion of foot. So inversion and eversion of foot. If this, imagine this is my foot, inversion inwards, eversion outwards, as simple as that. If I am inverting my foot, that is if I am trying to stand on my medial border of my foot, that is towards the hallux, towards the great toe. If I am trying to stand like this is called as inversion of both foot. This is called inversion of both foot. Similarly, if I am trying to stand, this is the normal anatomical position, if I am trying to stand on my lateral borders of my foot, that is standing like this, trying to stand like this, it is called as eversion of the foot. If possible, we'll make some demonstration videos later and we'll be uploading. Defining these movements is also very important, which is very easy if you are able to imagine these movements. Next, similarly in the neck we have few movements like flexion. So these are the articular surfaces of the neck. If this angle is decreasing, this is called as flexion of neck. This is the flexion of neck. And if this angle between the two surfaces is increasing like this is called as extension of neck. This is called as extension. This is called as flexion of my neck. Similarly, this angle also we can make it out, like decreasing this angle, that is sideward angle. This is sideward is in the sense lateral, away from the midline. So this is called as lateral flexion. This is called as lateral flexion. This is called as left lateral flexion. This is right lateral flexion. Yeah. Next, rotation. Rotation is a movement of, this is called as rotation. What's happening in the rotation? During rotation, the chin is moved towards the opposite shoulder like this. If it is right rotation, right side rotation, like this. If left rotation, like this. That is, the chin is moving towards the opposite shoulder in rotation. Okay. This rotation usually occurs along the longitudinal axis of the joint. Yeah. So that's the rotation of my neck. Next, protraction, retraction we already discussed in temporomandibular joint. Forward movement of my jaw, protraction. Backward movement of my jaw, retraction. Both are occurring at temporomandibular joint. Next, trunk movements. This one also we already discussed. Trunk movements usually occur at the level of hip joint. But here trunk movements, that is just forward bending and backward bending. So forward bending, if I bend like this at the level of hip joint, if I bend like this at the level of hip joint, at the level of my hip joint, if I am bending like this, is called as flexion of my whole trunk. My whole trunk is contributing to the, my whole trunk is now contributing to the articular surface, one of the articular surface. So like this. So this is called as flexion of my trunk. Similarly, getting back to the normal position is called as extension of my trunk. So flexion of my trunk and extension of my trunk, both of them are occurring at the level of my hip joint. Next, sideward movements. Sideward movement is called as lateral flexion. Similarly, this is also occurring at my hip joint. So this is called as lateral flexion. Next, sideward rotation. Yeah, during warm up we do rotations, right? That is called as sideward rotation. That is otherwise called as lateral rotation. That is, if we rotate our hip laterally, sidewards, if we rotate our hip sidewards, it is called as lateral rotation. That's what you need to know. That's about the trunk movements.